It is time now for Ask the Expert. A couple months back, there was a big outbreak of the parvo virus at area animal shelters.
A lot of vets still seeing puppies coming in with the virus. Joining us this afternoon, Dr. Katie Heinrich. She's joined by her coonhound mix, JJ.
So when we're talking about preventing parvo in dogs, what should owners be doing at this point?
So parvo is a very, very deadly disease, but the good thing about it is that it is extremely easy to prevent, and the prevention is just the vaccine. So we typically only see parvo cases in puppies that have not finished their full vaccine series yet, or in adult dogs that have never been vaccinated. That have never been vaccinated. So basically, if your dog is up to date on its routine vaccines, you should be prevented, but we're still seeing a lot of cases. So I do caution people that have puppies that are under 4 months old that have not completed their vaccine series to kind of be careful where you're taking them, to avoid places that have, heavily trafficked dog areas.
Because parvo is a problem that flares up when the weather gets nice. You're inside all winter long.
Right. Summer
comes, you're out in the park.
Yeah,
and that's when you're exposed.
It's always been around the Milwaukee area. We do see it, but it just, right now we are just really having a bit of an outbreak, and it does seem to happen more in the summertime.
So going for walks is okay, but maybe not like a dog park or like a doggy daycare. Would that be risky for puppies?
Well, most doggy daycares, the owners require that your dog be vaccinated, so that's actually a pretty safe place. The places you want to avoid are places where people can take their unvaccinated dogs that may be shedding the virus and may be sick and they don't know it yet. So it's a virus that's transmitted by the fecal-oral route, so the dog has to step in infected feces or lick them or eat them in some way, and the virus goes straight to their intestines, severely damages the lining of their intestine, and so the dog cannot digest anything. It disrupts the barrier of the intestine, so bacteria get translocated into the bloodstream, and they have very, very severe vomiting and typically a bloody diarrhea, not always, but sometimes, and they get so dehydrated and sometimes septic that they go into shock.
And real quickly, the vaccine is very cheap.
Extremely inexpensive and extremely effective. So the disease is very difficult to treat. We don't have a cure for it. It's just supportive care.
Get your dog vaccinated.
Yes, but it's expensive and it's messy and it's difficult
to treat it. All right, Dr. Katie Heinrich and her dog JJ.
Got a question for the experts? Email them, asktheexpert@today'stmj4.com, or leave a voicemail. Numbers on your screen.